Welcome, my dear students. We are going to start a new week, the 7th week, and the first lecture. And in this particular lecture, we are going to cover a very specific group of waste, particularly medical waste, which can be, either liquid or solid, and can be originated from, multiple sources, whether you talk about during your treatment, whether you talk about during, the process of your taking samples, particularly and mostly your immunization program, as well as we can also take samples particularly from the waste which is being generated during those surgical operations and multiple things. So this waste is going to cover all of them during starting from their treatment, starting from those particular immunization drive, and anything which is coming out of from medical sources. And this is going to be for both, means I am talking about animals as well as humans. So these waste can be generated from both these particular sources. So what we are going to cover today is basically, as I was mentioning, this biomedical waste management. Definitely we are going to give you a preview, and at the same time we will also deal at the end the legal aspect of your biomedical waste management perspective. So we are going to introduce you what is basically biomedical waste, and that there are different groups of biomedical waste and sources of this particular biomedical waste and classification of biomedical waste. So what is basically biomedical waste? I mentioned that those particular waste which is which is being generated out of either diagnosis, treatment, or immunization of human beings or animals, in research activities partnering thereof, or in production of testing biological material which poses a potential health risk. So these particular waste is having diverse resources particularly, right? And these discarded, as I was mentioning, that this is also going to include your discarded blood, needles, syringes, your cytotoxic pharmaceuticals, abundant medicine, chemical waste, and pathological microbes and many things, right? And this inappropriate treatment of this particular disposal of this waste is going to impact very negatively into our ecosystem as well as our human health. And I said the ecosystem means your local environment. And most of these particular waste which is being generated, out of which 85% of hospital wastes are non-hazardous, approximately 80% are infectious or maybe semi-infectious, right? And only 5% is non-infectious, but they are hazardous waste. That means maybe some radioactive material or maybe some heavy metals which are very carcinogenic in actions. So that is going to be included in there. In United States, 15% of the hospital wastes are infectious, and whereas in India it ranges between 5 to 10%. That means the the level of those the waste which is infectious is always going to be high mostly in your developed world. And if you look at the distribution, you can see over here that I was mentioning about those non-infectious wastes, right? And I said infectious waste, and then I said chemical or radioactive wastes. So this is containing those particular those proportions, 80%, 15% and 5%. And definitely these, when we are going to further classify it, definitely we will be looking at those particular definitive component of this, whether it is radioactive, cytotoxic, whether it is heavy metal, whether it is sharps, whether it is chemical and pharmaceutical related waste material, or whether it is pathological and infectious waste. So this we are going to further extend in the next slide. So when I was mentioning about this infectious waste, basically it is covering your mostly materials like blood soaked dressings, cultures and body parts that can transmit diseases and require strict handling and disposal protocols. That means these are very, very sensitive material, these infectious waste. And if we talk about non-infectious waste, these items such as those packaging material, non-contaminated equipment, and that pose lower health risks but still require appropriate disposal mechanisms or methods. And hazardous waste, I mentioned toxic, inflammable, reactive, chemical agents and pharmaceuticals, and necessitating careful management as well. So, infectious, non-infectious and hazardous. And now definitely the question already we started, deliberating on that where from these material are going to be originated. Main source are various healthcare related facilities where medical activities basically take place. During that process of your treatment, during that process of surgical operations, or during that process of immunization. So hospital and clinics are always going to be, the major contributor to this biomedical waste, and which basically generate your infectious waste, sharps, pharmaceutical waste and pathological waste, include your used syringes, your tubes, your blood stain, bandages and human tissues as well. And at the same time, apart from your hospital and clinics, laboratories and research center, they also contribute immensely to this particular biomedical waste. Medical and biological research facilities, basically they generate these hazardous chemicals and infected cultures. Waste includes laboratory culture, blood sample, contaminated glassware, and animal, care cases are also there because, during the process of those experimentation, this is most common. And then blood banks and diagnostic centers. This is also a hub of this particular biomedical waste, and which basically generate biohazardous waste such as your expired, blood samples, used blood bags and needles, and involve proper handling to prevent the spread of infectious diseases like HIV and hepatitis B and C. And also into this particular category, we have veterinary hospitals, because as I said, it's not only restricted to your humans, but as well as your animals also, right? Veterinary hospitals and animal research centers, they also generate the waste from animal treatments, surgeries and laboratory testing, includes animal tissues, infected body fluids, syringes and expired medicines. So these are those sources, particularly whether it is being generated from your hospitals and clinics, laboratories, as well as those hospitals related to your animal. And pharmaceutical company, they also generate this particular biomedical waste as well, produce expired drugs, chemical reagents and rejected medicines. Improper disposal definitely can make chaos. And nursing home and old age care centers, this is another source particularly for generating this waste, and this is almost similar to your hospitals, and including contaminated dressings and everything will be there. There will be dental clinics as well, and those extracted teeth, blood stained cotton, used needles, these are also, these will also come under this particular biomedical waste. Biotechnology and biomedical engineering units, particularly research-based units, they also produce waste from manufacturing prosthetics, implants and medical devices, includes your biopolymers, chemicals and defective biomedical equipment also. They will also come under this particular category. And home health care, self-administered treatments like your insulin injections, dialysis and wound care, they will also come under this particular category. And mortuaries and forensic laboratory, they also contribute to this particular waste generations. And if we look at these particular waste generations globally, this particular generation is a significant concern due to its impacts on health as well as the environment. And in India, approximately, if we look at the different cities, you will find in every metropolitan cities and across all the cities mostly, you have this particular, this biomedical waste is being generated. And approximately, if we look at the total amount, it's almost 517 tons of biomedical waste is being generated per day. And this waste basically comes from all the sources which I mentioned just earlier. And if you look at the different states, definitely you will be able to see that Uttar Pradesh is always, at the top, followed by maybe, Maharashtra is there, your Karnataka is there, and, Gujarat is also contributing at the same time, your Tamil Nadu. And most of those, health facilities and those, particularly hospitals, and they have most of their infrastructure is over there. So definitely they are going to contribute and they are going to generate this huge amount of this particular waste. And once I was talking about those different classification of biomedical waste, we mentioned about those particular waste related to your chemical, related to those infectious material, related to those pathological waste. We also mentioned about those radioactive waste and pharmaceutical waste. And this can be categorized on different categories, whether you talk about cytotoxic, radioactive, pharmaceutical, and then chemical, then infectious, and then pathological, and then sharps, and basically these are mostly those different categories, and based on these particular different categories, definitely they can be put under different categories, that under which category they can be put into, whether they are incommunicable, whether they are making some sort of biochemical inferences out of it, or biochemical consequences can be there, or maybe you can put them under the category of pharmaceutical, pathological, radioactive, or sharp waste sort of thing. And once we have that sort of classification available with us, definitely we will be able to make some sort of idea that how this is going to be sprayed, and what is the the lethal impact or effect of this particular waste. So basically we have seen that the source is already, we have explained that whether you talk about hospital, clinics, laboratories, industry, as well as atomic research center, and then dispensary, those transplant center and medical research center, they are always going to generate those particular waste. And if you put them under different category, I mentioned about those different categories of communicable, biochemical, pharmaceutical, pathological, and radioactive, and then sharp waste. And at the same time, if you look at the the description under every category, definitely suppose if it is communicable, the disease spreads such as waste polluted with body fluids and blood, and the issue is health, cleanliness, operation. So this is going to be very, very important. And if it is biochemical related one, so waste having biochemical elements such as taste, center substances, film maker, broken thermometer with mercury and antiseptics that are expired and further not required. So we need to take those safety issues are there, So, the issue is always going to be that lack of financial assistance is there in managing that particular, those waste material. And if it is drugs that are expired or no longer required, definitely it is going to create that sort of illness. So in every context, whenever we just deal with those particular waste material or segregated material or those different types of biomedical waste, definitely they have multiple consequences, whether it is related to health, whether it is related to safety issues, whether it is related to even soil impairment, because ultimately it is going to enrich your soil or environment. So definitely soil degradation, water pollution is also likely. So now we will come one by one. Basically infectious waste. This is that particular waste which is generated out of those sort of activities of your healthcare facilities, laboratory, research station, and medical procedures that contain infectious material. And there are multiple categories of this particular infectious waste, whether you talk about pathological waste, basically human tissues, organs, body fluids, they will come under that particular category. If you talk about sharp waste, definitely your needles, scalps, broken glass, and any sharp medical instruments, they will come under that category. If you talk about blood and bloody fluids, so mostly waste containing your blood, plasma, and other potentially infectious fluids will be there. Microbiological waste will be there, laboratory cultures, particularly of some particular organisms, petri dishes, and specimen containing those particular harmful microbes, which are very lethal, because if they are being introduced into your ecosystem, definitely they are going to impair your normal ecosystem services, and particularly with reference to your soil and water contamination is most likely. And then contaminated PPE and disposable, gloves, masks, gowns and bandages and dressings, and then pharmaceutical waste, expired and unused medications, those medicines, they are going to be very, very important under this category. And what are the risks involved? Basically, we have risk related to your illness. That means health hazards, direct exposure can cause infections. You have your environmental impacts. Improper disposal can contaminate this particular soil, water, or plant, animal, this particular domain. At any point of time, it can contaminate any of this particular component, whether you talk about water, whether you talk about soil, or whether you talk about air. And occupational risk, particularly for your healthcare workers and waste handlers and the general public faces significant exposure risks. Then comes your pathological waste, which is basically human or animal tissues, organs, and body parts and fluids which is removed during these particular medical procedures or treatments or operations or surgeries and autopsies and research. And there are human tissues and organs can be there. You have your animal tissue and carcasses will be there. body fluids will be there, placenta and fetal remains, and bone and teeth fragments. These will all come under this particular pathological waste. And this can be generated either, during those particular surgeries or veterinary clinics or any, the human, those hospitals and research stations. And many a time, these are some of those particular component which is going to create multiple consequences, because there are multiple risks are involved with this particular pathological waste. And then definitely it is going to create some of your infectious disease. I mentioned already those environmental contamination related to your disposal. If it is not properly disposed, definitely it can leach into your soil and water resources and can contaminate them. Occupational hazards, particularly with those particular who is handling those particular part, whether it is your healthcare worker, whether it is laboratory personnel, and ethical and legal issues, improper disposal, and this can violate health regulation and raise ethical concerns regarding human and animal remains. So these are those particular parts, organs and body parts which is coming under your pathological waste. Then comes your radioactive waste. This is basically those radioactive substances which is used in medical research or diagnostic procedure, because there are not only in research but in many cases even in diagnosis also they have been used. So these radio pharmaceuticals can be there, used in nuclear medicine, particularly in iodine and this technetium for cancer treatment and diagnostic imaging. This can be, this imaging particularly, this can be used. And contaminated equipment and PPE, globes, gowns and syringes, and your lab instruments exposed to radiation, and radioactive fluids and excreta. Patients treated with these radioactive pharmaceuticals, they may excrete those particular thing, and that can also create some sort of nuisance. And scaled and unscaled radioactive sources used in research, therapy and diagnostic imaging. And particularly animal carcasses and tissues, animal used in radiation based experiments, they can also come under that particular radioactive waste material. So definitely this is also comes under that particular huge amount of risk, whether you talk about those health risks that can cause radiation exposure leading to skin burn, leading to change in your genetic content, DNA damage can be there, or maybe cancer. And environmental contamination, definitely it is going to contaminate your soil, water and air component. And occupational exposure, this is basically I am mentioning mostly related to your healthcare worker or researcher or waste handlers who will be at a high prone of risk, particularly once they are going to handle it. Next category will be your sharps waste. Basically any object that can puncture and cut the skin and has been contaminated with basically with blood, body fluid and infectious agents. And under this there will be multiple. You can have your needles and syringes, you have your scalpels and blades, you will have your broken glass and your ampules, catheters and this particularly your guide wires, and then staples and these sutures. So these are going to be included under this particular sharps waste. You can see over here that these will be there. And if you have that sort of waste, definitely it is also going to have the similar sort of risks, whether you talk about infection, whether you talk about occupational hazard, and as well as your environment is going to be polluted and contaminated. And then comes your pharmaceutical waste, and this is basically those expired and unused and contaminated or discarded medicine from hospital and pharmacies, research facilities and households. And this can create nuisance as well, basically with reference to your expired medications, your contaminated your pharmaceuticals, your chemotherapy drugs, control substance, antibiotic and antimicrobials, right? These are mostly your, I am talking about those discarded antibiotics and vaccines and biologicals, pharmaceutical packaging and contaminated items. They will be all under this particular source of this pharmaceutical waste basically. And this is going to create similar sort of risks as we discussed in the earlier case, whether you talk about environmental contamination, because there are always a chance that these drugs can be introduced into your ecosystem. Particularly these drugs can be discarded in landfills or flushed into your water, can pollute your soil, river and drinking water, and basically can change the biodiversity of a system. Even in many cases antibiotic resistance can be there, improper disposal of these antibiotics. This can be lethal and can lead the growth of drug resistant bacteria. And this is going to make that particular microbiome disturbed or impaired. And then you may have a health hazards. Accidental ingestion or discarded medication can cause poisoning or overdose or toxic effects, and drug abuse and diversion, controls Basically, controlled substances disposed of improperly may be misused or illegally distributed, right? So these will come under your pharmaceutical waste, and then you have your genotoxic waste. And these particular substances are capable of causing genetic mutation, DNA damage or cancer, and highly hazardous and can cause long-term health impacts and environmental contamination, whether you talk about those cytotoxic chemotherapy drugs, whether you talk about those contaminated equipment or PPE or body fluids excrete of your patients, and then lab waste from your genetic research and radioactive pharmaceuticals. These are going to be either generated either on those research facilities or maybe in hospitals or maybe in those particular facilities where this can be used extensively. And then risks associated, similar sort of risks are also associated with this genotoxic waste as well. You have a cancer and genetic mutation which is very, very important and which is very, very lethal impact. Exposure can cause DNA damage and birth defect, infertility and cancer in humans. So if it is not properly managed, definitely you can understand the consequence, the severe occupational hazards for particularly your healthcare workers, your pharmacists and waste handlers are at the high risk if they are being exposed. And at the same time, you have your environmental contamination with reference to your soil, water and air. And then you have your chemical waste. The next category is chemical waste. Basically discarded chemicals, disinfectants, solvents and laboratory reagents which are mostly used particularly in these healthcare research and diagnostic activities. Mostly it will include your disinfectant and sterilant, laboratory reagents, pharmaceutical chemicals, heavy metals and toxic compounds, particularly mercury with a special mention, mercury from thermometers, lead, cadmium and arsenic from medical instruments. They are very, very lethal particularly to this your soil, water and air system. And then you have your radioactive chemical waste. This is used in nuclear medicine and radiopharmaceuticals. Solvents and fixatives used in histology and pathology labs, particularly in xylene or ethanol or methanol. This is most extensively used, as well as gas cylinders and aerosols and containers of compressed gases like oxygen, nitrogen and anesthetic agents. These can cause similar sort of risk as I mentioned with reference to your toxicity, with your corrosiveness, your flammability and explosiveness and environmental contamination. With reference to if I am talking about toxicity, definitely it is going to exposure, if somebody is going to be exposed with this, exposure to these particular chemicals can cause your poisoning, organ damage and respiratory issues. And this corrosiveness, sometimes this chemical can cause burn, skin irritation and eye damage, and flammability and explosiveness. These solvents and gases are highly flammable and reactive. It is always going to create that sort of fire hazard, and I mentioned already those environmental contamination. And high metal content in biomedical waste is also very likely, right? So this is basically whether you talk about those mercury containing devices, whether you talk about lead-based waste, I already mentioned where from those particular materials can come up, and cadmium and arsenic waste, particularly found in batteries, medical reagents and some laboratory chemicals, and cytotoxic drugs and radioactive waste, which are more common particularly with your chemotherapy drugs and electronic and medical equipment. Maybe some of your old machines, and whether it is your X-ray machines or monitors, they can also be contributed to this particular waste. And what are the risks which are associated? Almost similar. You have a toxicity which can cause your nerve damage, your kidney failure and developmental disorder. At the same time, if it is going to be bioaccumulated, these heavy metals, because whenever heavy metals in concern, definitely it is, and if it is going to bioaccumulate in your living organism, that can definitely can transmit to your human and animals and aquatic life as well. And environmental contamination can lead into your soil, water, air, everything already we discussed. And occupational hazards with reference to your healthcare workers, they are going to be affected most. And once we talk about these different types of your biomedical waste, and these can be categorized into as per this biomedical waste management and handling rules, this can be categorized into these 10 categories, and these categories and how this is going to be handled, because based on those particular, if it is a human and anatomical waste, always we can go ahead with incineration and deep burial. So that means, based on the nature of waste material, we can always plan or we can make that sort of strategy for, this management of this particular biomedical waste. If it is a waste sharps, definitely this disinfection by chemical treatment, autoclaving, microwaving and mutation and shredding And we can always, go ahead with this sort of, in many a time reusing, or else we can, shred them, or we can reuse it with some other purposes. And if it is, just I am giving one example of chemical waste. So this chemical treatment and discharge into drains and liquid and sequid, and which is being secured land for solids. So that sort of treatment is needed. That means the message is very clear that, based on these different types of category of waste, definitely we need to, make this sort of decision, particularly with reference to your biomedical waste management strategies. So particularly in this lecture, what we have tried to understand is, we try to understand the very unique nature of this particular biomedical waste, and at the same time we also try to understand the different categories of biomedical waste and their consequences, and how these different categories of biomedical waste, and what are their sources, and what may be the possible consequences which can be coming out of their mismanagement, that we have also seen. And we have also seen those different categories of waste, particularly if it is being properly handled, they can be used again. So that strategy has to be rationalized. So in the next few classes, definitely we are going to deal with more detail that how to handle this, because definitely you can all understand that if you are going to handle these very sensitive issues where you have there are chances of infection. So there are chances of infection, definitely we have to take that much of care. So we need to elaborate on those particular contexts in the very next few classes. So until then, thank you very much.